Yo, ever feel like sports doctors are speaking another language? Like they're dropping these crazy long
Oh,
words,
totally.
and you're just there like sauce trying to look smart, but secretly you're thinking, did I just agree to something involving needles the size of my forearm?
Happens all the time.
I swear, one time my buddy thought his MCL sprain was some kind of new energy drink. He was like all hyped up about it.
No way.
Yeah, until the doc was like, nah, dude, your knee's busted.
That's a perfect example of how, medical terms can sound totally foreign. But honestly, it's not some elite code.
Right.
It's more like understanding the building blocks of a super specific dialect, I guess.
Word. And that's exactly what we're diving into today. We've got this seriously helpful guide, Introduction to Medical Terminology, and our mission, which, spoiler alert, we've totally accepted,
Hmm.
is to decode this so-called secret language of medicine. No more nodding and smiling when the athletic trainer mentions something ending in itis. We're going to get you knowing what's what.
Yeah, our goal is really to give you the fundamental pieces of these medical terms. Think of it like Legos for health.
Legos, I like that.
We're going to look at prefixes, suffixes, and word roots. Once you get how these kind of snap together, even the most intimidating words start to make sense.
Seriously, this is your fast track to being in the know. You dig those aha moments, right?
Yeah, definitely.
Well, buckle up because we're about to drop a bunch of them on you without making your brain feel like it just ran a marathon in flip-flops.
What is a hysterosalpingo oophorectomy? Let's face it, understanding medical terminology can seem like a daunting task at first. And in reality, there is no possible way for anyone to memorize all of the words in a medical dictionary. So, what is a hysterosalpingo oophorectomy? Believe it or not, there is a simple way to learn and understand these kinds of words. Most words like this are simply a combination of different parts or elements, which include prefixes, suffixes, and word roots. Prefixes are syllables or elements placed at the beginning of a word root. It is used to make the word more specific. Suffixes are syllables or elements placed at the end of a word root and is used to indicate or describe a condition of the body and an action to a body part, such as ectomy, which is the procedure of surgically removing an organ. And word roots are the main elements within the medical term, of which prefixes, suffixes, and connecting vowels are added to. These elements can be identified by specific characters. A root word will be followed by a forward slash, a suffix will follow a hyphen, and a prefix will precede a hyphen. Although these elements can be identified by these specific characters, the best way to be sure is through practice. By learning the meaning to word roots and the meaning of suffixes and prefixes. Learning this course will also enhance your ability to score better in the English portion of the SAT test and other similar tests such as ACT. Root words are frequently associated with a body part. A word root is always the subject or main topic of the medical term. For example, heart. Word root for heart is cardi, cardo, or even cardio. The slash is where the connecting vowel attaches to the root. An example, cardiomegaly. The method for deciphering a medical term is that you start with the last word part and work yourself up through each element until you get to the first element of the term, which would most likely be a prefix. So you would need to decipher first the suffix, in this case being megaly. Megaly means enlargement. The next element is the main element of the term, which is called the word root. Cardio, which means heart. The complete meaning for this term, cardiomegaly, is enlargement of the heart. You can then say, this term is indicating that the heart is larger than normal. Let's take a look at another example. Appendicitis. Our word root is append, which is the appendix. The suffix is itis, meaning inflammation or inflammation of. Appendicitis is the inflammation of the appendix. If you add the prefix pseudo to appendicitis, you get the word pseudoappendicitis. Pseudo means false. Pseudoappendicitis is a false inflammation of the appendix. The prefix typically serves to further define a word root. When prefixes, suffixes, or word roots are joined together, vowels can be added for pronunciation purposes. This is called combining form vowels. Of course, there are always exceptions, but the general rules are: a combining vowel is used when the suffix begins with a consonant, as with the word encephalogram. A combining vowel is not used when the suffix begins with a vowel, as in encephalitis. And a combining vowel can also be used when two or more word roots are joined together, such as with pseudoappendicitis. Keep in mind, the use of combining form vowels, which is typically the vowel O, is primarily used for the sake of being able to pronounce the medical term, not so much for the sake of proper grammar. The combining form vowels neither adds nor does it subtract from the term's meaning. Let's take a look at one last example. This one is a little more of a challenge. The original word that we looked at, hysterosalpingo-oophorectomy. What a mouthful. And very important to note, if you are not aware of the meaning of a medical term, it can be very intimidating when medical personnel use terms like this. Medical personnel need to always remember that most people do not know what these terms mean. Under practicing medical ethics, it is very important that you use words or descriptions that the patient or client understands. What does hysterosalpingo-oophorectomy mean? Let's follow the formula provided earlier. First, let's break down the term into elements. These are prefixes, suffixes, and word roots. Here's the breakdown, beginning from the right and moving to the left. Ectomy, which means surgical removal. Oophoro is a root word for ovaries. Salpingo is a root word for fallopian tubes. And then the last element is hystero, a root word for uterus. Continuing the pattern on how to decipher a medical term, reading from right to left: surgical removal of ovaries, fallopian tubes, and uterus. It is now possible to understand the medical term hysterosalpingo-oophorectomy. This term is a description of a medical procedure commonly known as a hysterectomy. Just because these words may look intimidating, doesn't mean that they have to be. Simply learning basic prefixes, suffixes, and word roots will enable you to understand a lot of terminology you would have never imagined before. A very proven method of learning the meaning of prefixes, suffixes, and word roots is by using flashcards. Very simple to do. Watch. You can place a prefix, suffix, or word root on the front of a card, and the meaning on the back. This easy study method is a great tool in learning medical terminology. But the best way to learn anything is to apply it. Throughout this series of videos, as you learn about the anatomy and physiology of the human body, you will be applying your knowledge of medical terms by learning them according to organ systems.
Hey guys, John the Backwards Dude here, and I'm the guy that sings and talks backwards. Today I have got a request up from YouTuber Andrew is taken. I guess he's taken by me, I don't know. Well, he wants me to say pneumono ultramicroscopic silicovolcanoconiosis forwards and backwards. Well, there's forwards for you, Andrew is taken. Backwards is Alright, let's rewind that and see how well I did. Alright, pneumomicroscopic silicovolcanoconiosis. Make sure to leave me your requests of anything you want me to say backwards, all right? So I will be checking this and hopefully once a week be posting. Until next time, Bjarksbusne, Stwasi, peace out, and subscribe.
Look, I'll take 10, you take 10. Get in, get out. No smiling, no hugging, no letting no cry. Just be quick about it.
You're the one that's slow.
I am not slow. You are slow.
You want to bet?
Yeah, you are.
A comprehensive workup
Did not reveal any
vascular abnormalities.
Your Doppler was negative.
Vertebral venous thrombosis, so there's no need for chronic
Coagulation or an IVC
Your
filter
biopsy was, however, positive
for a mixed anaerobic
non-group-based streptococci infection.
Your BUN and creatinine elevations had us worried,
Rapidly progressive glomerulonephritis.
which could have signaled an autoimmune disease.
What does that mean?
We're not going to amputate your leg.
You get to keep your kidneys.
Congratulations. You can go home today.
Yeah, congratulations, whatever.
Congratulations. There's nothing wrong with you. You're going to be fine. Congratulations.
Okay, let's break this down.
So peep this. Medical terms aren't just random letters mashed together. Our source breaks it down. They're built from 4 main types of word parts. Word roots, combining forms, suffixes, and prefixes.
Okay, 4 parts.
Yep. And today's play is to be able to sort words into these categories and take those longer medical terms and split them into their individual parts.
It's like putting together a puzzle, right? The source even mentions that.
Exactly.
You've got all these different shapes, and once you figure out how they connect, the whole picture pops.
Exactly. Word parts are like those individual puzzle pieces in the medical world.
Yeah.
So let's start with the main deal. Word roots. Okay, so a word root holds the main basic meaning of the medical term. A lot of the time, it points to the body part that's involved.
Right, like the core subject.
Precisely. Fun fact, a word root can even tell you a color. But the key thing to remember is that word roots usually can't stand alone as complete words. They need backup.
Gotcha. So it's the core meaning, but it needs its squad to make a full sentence, you feel me? Can you hit us with a super simple example? Let's say we're talking about your ticker, your heart.
Bet. The word root for heart is cardi, C-A-R-D-I.
Cardi, okay.
You'll see this pop up in a ton of heart-related terms.
Yeah.
But like solo cardi isn't a complete medical term, but it carries that central meaning of the heart.
Okay, cardi equals heart. Solid. Now, what's the deal with these combining forms? Sounds kind of sci-fi.
Yeah, a little. A combining form is basically a word root that's added a connecting vowel at the end. Yeah, and that vowel is usually an O. Think of it as a root that's ready to link up.
An O, easy peasy.
Yeah.
So when do we actually bust these combining forms out?
Well, we use them in a few key situations. First, when we're adding a suffix that kicks off with a consonant.
Okay.
Second, if a combining form shows up kind of solo, our source mentions it's sometimes written with a slash, like cardi.
Yeah, right, cardi slash.
And third, when we need to link 2 word roots together, we usually add that O to the first root.
Okay, so that O is like the handshake emoji between different parts of the word.
That's a good way to put it.
Can you throw us a quick example using our cardi root?
For sure. Let's say we want to talk about recording the electrical activity of the heart. We'll get to suffixes later, but the root for heart is cardi, right?
Right.
And to connect it with the suffix ogram, meaning a record, we use the combining form cardio to make cardiogram.
Cardiogram,
See how that O makes it flow? Cardiogram.
I'm tracking. That'll definitely makes it sound smoother. All right, let's slide into suffixes. These always come at the end, right? Like the period at the end of a sentence.
You got it. Suffixes are always stuck to the end of a medical term, and they give you crucial info about the word.
Okay.
They usually tell you about a procedure, a condition, a disorder, or a disease. It's like the grand finale of the word.
Okay, so that ending can tell you what's actually going down. The source mentions some popular categories of suffixes. Let's jump in. First up, suffixes as nouns.
Yep, some suffixes turn the root into a noun. Examples from our source help name things.
Okay, I'm trying to brainstorm an example, like bacteria ends in A. Is that a noun suffix in this context?
Good observation. While bacteria itself isn't formed from a single root and suffix in the way we're talking about, you're right that A can be a noun ending in medical terms. It often points to a condition or entity. So yeah, keep that in your mental Rolodex for later.
Dope. Next up, suffixes meaning pertaining to. This sounds crucial for describing stuff.
Totally. These suffixes tell us that something is related to a specific body part or situation. Common ones listed are ak, al, and ak, and ike.
An I, a nine.
Yeah, and the source gives solid examples like cardiac pertaining to the heart.
Ah, there's cardi again.
Exactly. Renal pertaining to the kidney, and ovarian pertaining to the ovary.
Cardiac heart related to. Boom. Okay, what about suffixes meaning abnormal condition? These sound like the red flags of medical terms.
They often are. These suffixes signal that something isn't quite right in the body's system. The source mentions osis, azimas, aya, ago, and iasis. It also points out that some suffixes generally mean abnormal condition or disease, and gives gastrosis as an example, any disease of the stomach.
Okay, so if I hear something ending in osis, it's probably not a good vibe. Like psychosis, right? Though that's more mental than physical.
Correct. Well, the specific root tells you exactly what's up. That osis suffix generally points to an abnormal state or condition. Good connection.
All right, moving on to suffixes related to pathology. Sounds kind of heavy.
Well, pathology is the study of diseases, so yeah, these suffixes are all about when things go sideways in the body. We've got algia and adenia, both meaning pain, ouch. Then itis, which we hear all the time, meaning inflammation, think like a sprained ankle.
Oh yeah, itis is everywhere.
Totally. Megaly means enlargement, like if your spleen gets too big.
Yeah.
Malacia is abnormal softening. Necrosis is tissue death.
Necrosis, okay.
Sclerosis is abnormal hardening. And stenosis is abnormal narrowing.
Whoa, that's a lot to digest, but super helpful. Suddenly, words like tendinitis, tendon plus iditis, inflamed tendon, snap into focus.
Exactly. You're already a code breaker. Then we have suffixes related to procedures. These tell us what's being done to fix or figure things out.
Like surgery or tests.
Precisely. Our source lists centesis for surgical puncture, like drawing fluid. Ecography is producing a picture, like an X-ray.
Okay, yeah.
Plasty is surgical repair, like reconstructive surgery. And roscopy is visual examination with a scope.
So an arthroscopy, arthrojoint acroscopy visual exam, is looking inside a joint. Got it. And finally, the double R suffixes. These sound intense.
They often are. These include raj, meaning bleeding like a hemorrhage.
Okay.
Rography is surgical suturing, stitching something up. Wari means flow or discharge, like diarrhea. And rhexis means rupture, like a muscle tear.
Ooh.
Yeah, definitely words you don't want popping up in your medical report too often.
Right. So, just to recap real quick, a suffix at the end totally flips the meaning of the word, telling you what's up, condition, procedure, the whole 9 yards.
Nailed it. Now let's flip to the front of the word and talk about prefixes. These guys set the stage.
Prefixes. These come right at the beginning, like the opening scene of a movie. What kind of info do they drop on us?
Prefixes are added to the start of a medical term, and they usually tell you about things like location, time, number, quantity, direction, or size.
Okay.
They add context right off the bat.
Okay, so setting the scene for the root word, the source highlights some contrasting prefixes. This looks like a cheat sheet for understanding opposites.
It totally is. Knowing these pairs can be a game changer. We've got ab meaning away from versus ad meaning toward.
Ab away, ad toward. Got it.
Then is meaning bad or difficult versus you meaning good or normal.
Dis bad, you good. Okay.
Ex meaning outside versus in meaning inside. Hyper meaning excessive or above normal versus hypo meaning deficient or below normal.
Hyper high, hypo low, classic.
Right. Inter meaning between versus intra meaning within. Macro meaning large versus micro meaning small.
Macro, micro, easy enough.
Pre meaning before versus post meaning after. And finally, sub meaning under or below versus super meaning above or excessive.
That's an awesome list. Just knowing those pairs can probably unlock a ton of medical terms like hypertension, hyper-high tension pressure versus hypotension, hypo-low tension pressure. See? We're leveling up.
You absolutely are. Now that we've got the building blocks down, the real skill is in taking these terms apart when you see them in the wild.
Okay, so we're staring down a scary-looking medical word. What's our play-by-play?
The source gives us a solid 3-step strategy. First, always start at the end of the word and identify the suffix.
Start at the end.
That's usually your biggest clue.
Yeah.
Then, identify the meaning of each of the word parts as you work your way backwards.
Work backwards. Got it.
Finally, think about the context in which the term is being used to make sure the overall meaning makes sense in that situation.
Got it. Start at the finish line, work your way to the start, and keep the big picture in mind. The source uses hyperthyroidism as an example. Let's break it down using our newfound skills.
Excellent. So we start at the end. The suffix is ism.
Condition of.
Right, which generally means a condition or state of. Moving to the middle, we've got thyroid, which, you guessed it, refers to the thyroid gland.
Thyroid gland, check.
And at the beginning, we have the prefix hyper, meaning higher than normal or excessive.
Hyper, higher than normal.
So, putting it all together, hyperthyroidism is the condition of having a higher than normal functioning thyroid gland.
Easy peasy, right?
Nailed it. Okay, I'm feeling confident. Let's do some practice rounds.
Yeah.
Let's take the term antitussive from the source. Break it down for us.
All right. We have antitussive.
Antitussive.
The suffix "ive" here means having the quality of. The root tusses refers to a cough.
Okay. And the prefix antior means against. So an antitussive is a medication that has the quality of being against a cough. In other words, a cough suppressant.
Oh, okay.
Makes sense for cold and flu season, right?
Totally. Next up, endotracheal. Endotracheal. What's the breakdown here?
Okay. The suffix means pertaining to. The root trach refers to the trachea or windpipe.
Trachea, windpipe. Right.
And the prefix endo means inside or within. So endotracheal means pertaining to the inside of the trachea.
Inside the windpipe.
Yeah, you might hear about an endotracheal tube being used if someone needs help breathing.
Right. That paints a clear picture. Okay, let's try a longer one. Pyelonephritis. Pyelonephritis. What's going on under the hood with this one?
Okay, bit longer. Here we've got the suffix aitis, which means inflammation.
Itis, inflammation. Check.
The root nepher refers to the kidney.
Yeah, for kidney.
We also see the combining vowel o linking pyle and nepher. The root pyle refers to the renal pelvis, which is part of the kidney.
Pyle, renal pelvis. Okay.
So pyelonephritis is an inflammation of both the renal pelvis and the kidney itself. Definitely not a fun diagnosis.
Nope. Sounds rough. Okay, how about dermatoplasty? That's dermatoplasty. Lay it on us.
Right. The suffix plasty means surgical repair.
Plasty, surgical repair.
The root dermat refers to the skin.
Dermat, skin.
And again, we've got that handy combining vowel o. So dermatoplasty is the surgical repair of the skin, often involving grafting after a burn or injury.
Skin repair.
Yeah.
Okay. Last one for breaking down, hypocostal. Hypocostal. What's the story here?
So the suffix "ile" means pertaining to.
Pertaining to.
The root cost refers to the ribs. Think about your costa cartilage.
Cost ribs. Yep.
And the prefix hypohio means below or under.
Hypo, below.
Therefore, hypocostal means pertaining to below the ribs. You might hear that term in describing pain location.
Amazing. I feel like I've got a secret decoder ring for medical terms now.
Now, let's try going the other way. The source throws some parts at us and asks us to piece them together. First up, pandemoic. What word do we get when we mash these up?
Okay. Putting them together, we get pandemic.
Pandemic.
Ah. The prefix "pam" means all or everywhere. The root "dem" refers to people or a population with that connecting "o." And the suffix "a" means pertaining to. So a pandemic is a disease pertaining to all people or spreading everywhere.
Yeah.
Sadly, a term we're all too familiar with these days.
No kidding. Okay, next up, angiostenosis. What's the final word here?
That combines to form angiostenosis. The root "angi" refers to a blood vessel.
Angi vessel.
Linked with our pal "o." And the suffix stenosis means abnormal narrowing.
Stenosis narrowing.
So angiostenosis is the abnormal narrowing of a blood vessel, which can cause some serious health issues.
Definitely not ideal for good circulation. How about urethroragia? What's the outcome? That gives us urethragia. The root urethra refers to the urethra, connected by O. The suffix erogia means bleeding.
Bleeding, right, the double R.
Exactly. So urethragia is bleeding from the urethra. Ouch.
Yeah, that sounds pretty unpleasant. Let's move on to hemangioma. What does this build?
That forms hemangioma. The root hem refers to blood, with a connecting O.
Hem, blood.
The root angi refers to a blood vessel, also with a connecting O.
Angi, vessel again.
And the suffix oma often indicates a tumor.
Oma, tumor. Okay.
So hemangioma is a tumor made up of blood vessels, usually benign, but still good to keep an eye on.
Okay, last one in this putting together category. Sternocleidomastoitis. This looks like a serious tongue twister. What do we get when we put it all together?
You're right, it's a mouthful. That forms sternocleidomastoiditis.
Oh.
We've got multiple roots here, stern for sternum or breastbone,
Sternum.
clyde for clavicle or collarbone,
Clyde collarbone.
and mast for the mastoid process, that bony bit behind your ear.
Mass behind the ear.
They're all linked with combining vowels.
Yeah.
And the suffix iditis means inflammation.
Itis, inflammation. Still got it.
So, sternocleidomastoiditis is an inflammation of the sternocleidomastoid muscle, which runs from your chest and collarbone up to your neck.
Ah, that big neck muscle.
Yep. You might pull it during a tough workout.
See? Even the super long, intimidating ones can be decoded. Now, our source also briefly touches on disease terms themselves. It's not just about the parts, but how we actually describe illnesses.
That's right. Understanding the language used to describe diseases is just as important as knowing the individual word parts. Our source defines a sign as objective evidence of a disease, something a doctor can see or measure, like a rash or a fever.
Okay, a sign is something you can see.
Yeah. A symptom, on the flip side, is subjective evidence, something the patient feels and tells the doctor, like fatigue or pain.
Symptom is what you feel. Got it.
And a syndrome is a group of signs and symptoms that often occur together, painting a picture of a particular condition.
So a swollen ankle is a sign, but feeling dizzy is a symptom. And those together might point to a specific syndrome. What about diagnosis and prognosis? We hear those terms all the time, especially with the athletes getting sidelined.
Right, so diagnosis is the process of figuring out what disease or condition someone has.
The what?
Exactly. Differential diagnosis is like playing medical detective. It's when doctors consider a few different possibilities that could explain the signs and symptoms. And prognosis is the doctor's best guess about how the condition will likely progress and what the outcome might be.
What's going to happen?
Pretty much.
Yeah.
For athletes, that prognosis is key for planning their recovery and return to play.
Okay, so diagnosis is what it is, differential is what else it could be, and prognosis is what's likely to happen down the road. Got it. The source also mentions acute and chronic conditions, which we hear a lot in sports injuries.
Exactly. An acute condition pops up suddenly, is usually severe, and doesn't last very long. Think a sudden hamstring strain during a sprint.
Quick and dirty.
Right. A chronic condition, on the other hand, develops over time and sticks around for a long while, like osteoarthritis, in a joint that's been through a lot of wear and tear.
The long haul.
Yeah. Remission is when the symptoms of a chronic condition lessen or even disappear temporarily, even though the underlying condition is still there.
So acute is like a flashbang, chronic is a slow burn, and remission is like hitting the pause button on the symptoms. Finally, the source touches on disease, eponyms, and acronyms.
Right. A disease is basically when some part of the body isn't working normally. An eponym is when a disease or medical thing is named after the person who first discovered or described it, like Lou Gehrig's disease.
Named after someone.
And an acronym is a word formed from the first letters of a longer term, like ACL for anterior cruciate ligament, a common one for athletes.
Oh yeah, ACL. Everyone knows that one.
Exactly.
So recognizing those pathology suffixes we talked about earlier, like itis or ocasis, can be a major clue when we come across a disease name. If it ends in itis, you can bet there's some inflammation involved.
Absolutely. That knowledge of word parts gives you context and helps you understand the basic nature of the disease being described, even if you haven't heard of that specific condition before. It's super useful.
The source also briefly mentions look-alike and sound-alike terms. This is where things can get super confusing, right?
Yeah.
Like my buddy with his MCL sprain energy drink idea.
Totally. Medical terminology can be intimidating, and there are definitely words out there that can trip you up because they look or sound really similar. Knowing those root words, prefixes, and suffixes can be super helpful in telling them apart and avoiding some serious oops moments in communication.
Okay, so to bring it all home, this whole medical terminology world isn't some impossible fortress to conquer. It's more like a puzzle you can solve piece by piece. You've got your main parts, roots, prefixes, suffixes, and once you get how they connect, you can figure out even the most complicated sounding terms.
That's a great way to put it. And this understanding isn't just for doctors and nurses.
Yeah.
For you, the listener, it's about feeling more empowered when it comes to your own health.
Yeah, being in the driver's seat.
Exactly. It's about being able to have better conversations with your healthcare team, understanding what's going on with your body, And not feeling totally lost when you read or hear health-related information. It's about taking control of your own health knowledge.
So your mission, should you choose to keep rocking with us, is to start noticing medical terms when you hear them. Whether it's on the news, during a game commentary when someone gets injured, or even in a casual conversation. Try to break them down. See if you can spot those roots, prefixes, and suffixes we've talked about. You might be surprised at how much you can figure out you've got this.
And that curiosity, that willingness to, dig a little deeper and understand is your most valuable tool. Keep asking questions, keep learning, and you'll find that the language of medicine becomes a whole lot less mysterious and a whole lot more manageable. You've definitely taken the first big step today.